Hello, good afternoon, ladies and gentlemen. So it's a late afternoon and I know all of you are tired, but still I have a task to perform and tasks are tasks. So my topic today is leveraging SSTC for universal health coverage. And as you know, I am an additional secretary at the Population, Family Welfare and Law Wing of the Medical Education and Family Welfare Division. And I am currently the PCC of PPD. So what we all know is that health is of course a fundamental human right, and good health enables children to learn and adults to earn, and it helps to reduce poverty. And we are now fighting, we have attained MDGs. Bangladesh has been a success story in attaining the MDG goals. Now we are on the way to attain the SDGs, and universal health coverage is a commitment and a system where everyone, everywhere has access to high quality health care services that they need and without facing financial hardship. And it includes health promotion, prevention, screening, management, rehabilitation, and palliative care services. This is a new era in our health services, and we are trying to accomplish whatever we can with all stakeholders. You know that we have made significant strides in healthcare, but we face persistent inequalities, especially in rural and marginalized communities. And primary health care is the foundation of a strong health system. But however, we only spend 1.5% of our GDP on health, which is far below the global average of 5.9%. And we see in the slide that at least half of the world's population still do not have full coverage of essential health services. We all know that. And about 100 million people are still being pushed into extreme poverty due to health care costs. The situation of universal health coverage in Bangladesh is such that although we have made significant strides, the current status is that we have achieved only 52 out of the 100 criteria for achieving the UHC. The key considerations for achieving UHC are strengthening primary healthcare services, expansion of infrastructure and supplies, community health workers. We need to expand and strengthen the network of community health workers, health workforce development, training programs, incentives, and retention. Retention is a big problem. You know, in the grassroots level, our doctors and other health professionals, they do not want to stay there because of some, when people have to stay in a place, they have to have some amenities, and sometimes we cannot provide that fully. And there are other issues which we will come across. Leveraging the SSTC for universal health coverage involves collaboration between countries of the Global South, which is very important. And the key strategies that we have put out are training programs, research collaborations, policy exchange, technical assistance like kids, medicine and communities, and health information system. Bangladesh has done very well in the digital arena. You know, we have achieved the digital Bangladesh dream of our Honorable Prime Minister in 2021, and we have many people now have access to digital services, and we have union digital centers where people can have access to many online facilities. And health information system is still a challenge. We have to work on that as well. The health policy framework, we have a health policy of 2011. We need to revise it according to the needs of the current time. We are already doing the sector-wide approach, which means implementing health, population, nutrition sector program. It is integrated and comprehensive. The community clinic initiative is a beautiful initiative which has established more than 14,000 community clinics across rural areas. This was also a dream of our Honorable Prime Minister, and she received an award for it from the UN. And we are providing primary healthcare services through these centers at very grassroots level. Shastha Surakha Karmashuchi, which is a sort of health insurance program, maternal health voucher scheme, community-based health insurance, development of healthcare financing strategy, digital health initiatives, health insurance pilot programs. And in forums like these, I sometimes wish that we could have a field trip for people who come from across the world, so we could see for ourselves practically what we do at the community clinics. That could be very well, but due to shortage of time, we cannot manage certain things. Primary health care, you all know, is a driving force for universal health coverage. It empowers communities, which is very important. We need to empower the people. And everyone should have the right to their own health and well-being. So we need to empower them, and we need to promote social accountability, multi-sectoral action, and we have to enable integration of healthcare services, and innovation is so very important. The Ministry of Health and Family Welfare of Bangladesh has taken initiative to implement primary health care operation plan for improving access to affordable and quality primary health care for UHC. Here you see in the center picture, we have two of our healthcare facilities that is at the sub-district level. We have a school health clinic on the right, and on the left, that is Union Health Care Center. And you see all the things we are now doing at the community. We have door-to-door visit by family welfare assistants. There are courtyard meetings at someone's courtyard. We arrange that. Satellite clinics. It means that from one place, people once a week or twice a week go to a certain household. They have a makeshift clinic. And we have school health program. We are doing promoting adolescent health sessions. And this is a community clinic where you see our Honorable Prime Minister and many other activities. And that is another thing at the lower right corner, the ready-made garment, which is a big sector. And we now have some program from the Director General of Family Planning. We give reproductive health services sometimes at the factories, the RMG factories. So maternal and child health programs, we have the EPI, non-communicable disease program, health information system, and international collaboration we receive from World Health Organization, World Bank, and various other donor agencies like UNFPA, UNICEF, and other non-governmental organizations. And we are also doing infrastructure development. I already told you we have more than 14,000 community clinics. Digital health technologies we are trying to promote, and resource mobilization is very important. So we are also trying to pool funds and jointly procurement in essential medicines and medical supplies to reduce costs, and innovative financing approaches. We are exploring possibilities of innovative finance. This already I have told you. So examples of SSTC, for the forum like this, we seldom get opportunity for 22 countries to get together. So what have we done? I mean, the whole world, there has been the Africa-Brazil cooperation. Brazil's experience with its family health strategy has been shared with African countries. The BRICS countries, they collaborate on various health initiatives, including UHC. China-Africa health development. China has been actively involved in supporting health infrastructure and providing medical teams in various African countries. China-Bangladesh cooperation. This is a very good project that we just completed, and I was with it fully throughout the project, and we have reduced maternal mortality in many areas, and it has been proven, evidence-based. Bangladesh, Myanmar, Nepal, Norway, improvement in the quality of leprosy and disability services. Bangladesh-Bhutan cooperation, Gambia and Bangladesh, access to information services, process simplification, civil service reform, digital service design lab, these are all in the pipeline. Advanced cost-effective and climate-resilient technologies for bridge construction in Nepal, transit trade between Bangladesh and Bhutan via India, water farming for climate-resilient agriculture, and disaster preparedness in India and Bangladesh, and so on. You can see, I don't want to read. Well, we have challenges. It's true, all countries have challenges. What are the challenges we are facing? Resource is a big challenge. That's why we meet, SSTC, we need collaboration. Equity issues, ensuring equitable access to healthcare across different regions. We have some hard-to-reach areas, and climate change is a big factor. Our southern regions have salinity, and due to the salinity, many health problems we are facing. Governance and coordination is an issue. Larger policy-level barriers, implementation barriers in health sector, demand-side barriers, cross-cutting barriers are lack of common understanding among different stakeholders. What are the suggestions from the stakeholders to overcome? We have to redesign the public financial management. This is a bit very easily said than done. Health insurance and health financing reform, still these are very gray areas that we have not really trodden upon. Improve regulatory framework and mediatory mechanisms, intersectoral collaboration, which is so important between civil service organization, public sector. There is lack of understanding, and political commitment is there, but we need to work. We need to, what we can do to address the barriers. Health system strengthening, improve health service management, improve the monitoring supervision. We need to inform the ICT sector, improve health promotion and disease prevention, deciding on adhering to quality criteria, code of conduct, improve efficiency, special attention to hard-to-reach areas, and decentralization. And we need to educate the patients and the clients, community empowerment. We need to do more research and advocacy. Advocacy is so important. So all these things are very easily said than done, but these are the forums where we need to, I have been listening to some of the presentations, and we need to collaborate and co-create, and we need to act together for a better future. Thank you so much.